Which of the following is the treatment of choice for Kawasaki's disease? Option A, cyclosporine. Option D, dapsone. Option C, IV immunoglobulin. Option D, methotrexate. The answer is option C, IV immunoglobulin. Kawasaki disease, also known as mucocutaneous lymph node syndrome, is an acute febrile disease affecting the lymph node, mucous membrane, wall of blood vessels, and heart. Kawasaki disease often begins with a high and persistent fever greater than 102 degrees Fahrenheit, lasting at least 5 days. The fever may be last for up to 2 weeks, and doses not usually resolve with acetaminophen. Other symptoms of Kawasaki disease are bright red or cracked lip, strawberry tongue, swelling and redness of hand and sole of feet, lymph node enlargement, particularly in neck, joint pain. High-dose aspirin and intravenous immunoglobulin is the standard treatment of Kawasaki disease. After overnight fasting, level of glucose transportase get reduced in option A, brain cell, option B, adipocytes, option C, RBC, option D, hepatocytes. The answer is option B, adipocytes. Which of the following pulses has the highest iron content? Option A, Bengal gram. Option B, red gram. Option C, black gram. Option D, soybean. The answer is option D, soybean. So a half cup of soybean serving contains 4.42 milligram iron. Extrapyramidal symptoms are a complication of the treatment with which of the following drugs? Option A, antipsychotic drug. Option B, antidepressants. Option C, anti-anxiety drugs. Option D, anti-malarial drug. The answer is antipsychotic drugs. Iron and folic acid tablet supplied by Government of India contains option A, 60 mg element iron and 500 microgram folic acid. Option B, 100 mg element iron and 500 microgram folic acid. Option C, 200 mg element iron and 1 mg folic acid. Option D, 100 mg element iron and 5 mg folic acid. The answer is option B, 100 mg element iron and 500 microgram folic acid. The Ministry of Health and Family Welfare, Government of India, has launched the weekly iron and folic acid supplementation program to reduce prevalence and severity of nutritional anemia in adolescent population. Weekly iron and folic acid supplementation program will be planned and implemented for following two target group in both rural and urban areas. Category A, adolescent girls and boys enrolled in government or government aided or municipal schools from 6th to 12th classes. Category B, adolescent girls who are not in school. The weekly iron folic acid supplementation program will also cover married adolescent girls. Pregnant and lactating adolescent girls will be given iron folic acid supplements according to current guidelines for antenatal and postnatal care through the existing health system of NRHM. Under the weekly iron folic acid supplementation program for adolescent, iron folic acid supplements are to be distributed free of cost on weekly basis to the target groups in categories A and B. In addition to iron folic acid supplements, albendazole tablets for deworming are to be administered twice a year to the same target groups. Administration of weekly iron and folic acid supplementation. Each iron folic acid tablet containing 100 mg elemental iron and 500 microgram folic acid for 52 weeks in a year. The amino acid that is deficient in wheat is option A leucine, option B methionine, option C lysine, option D cysteine. The answer is option C lysine. What is the glucose level of normal CSF? Option A 100 to 110 mg, option B 10 to 20 mg 100 ml, option C 135 to 145 mg, option D 45 to 75 mg 100 ml. The answer is 45 to 75 mg per 100 ml. Normal CSF glucose is 50 to 80 mg and protein is 15 to 45 mg per deciliter. What should be the first action the nurse will initiate on seeing a straight ECG baseline? Option A start CPR, option B unplug other electrical equipment and note any changes in waveform, option C remove or loose electrode and reapply, option D check patient's response. The answer is option D check patient's response. First, check the patient's response. Shout for help. Look for no breathing or only gasping and check pulse simultaneously. No normal breathing if pulse felt. Provide rescue breathing. 1 breath every 6 seconds or 10 breaths per minute. Check pulse every 2 minutes. If no pulse, start CPR. No breathing or only gasping, pulse not felt, start CPR. Perform cycles of 30 chest compressions and 2 breaths. Defibrillator arrives. Check rhythm. If rhythm is shockable, give 1 shock, resume CPR immediately. If rhythm is non-shockable, resume CPR for 2 minutes. Which of the following assessment finding is typical of extracellular fluid loss? Option A distended jugular veins, option B elevated hematocrit level, option C rapid thready pulse, option D increased serum sodium level. The answer is option D elevated hematocrit level. Normal hematocrit value of male is 41 to 50% and female is 36 to 48%. High hematocrit level seen in heart disease, dehydration, lung diseases, bone marrow disease, obstructive sleep apnea, smoking, carbon monoxide poisoning, use of testosterone. Low hematocrit level seen in blood loss, leukemia or other bone marrow problems, iron deficiency, vitamin B12 and vitamin B6 deficiency, too much water in the body, kidney disease, thyroid abnormality, immune destruction of red blood cells. When a client develops ventricular fibrillation in a coronary care unit, what is the responsibility of the first person reaching the client? Option A administer oxygen, option B initiate injection amiodarone, option C initiate defibrillation, option D initiate CPR. The answer is option C initiate defibrillation.